Hello, everyone, and welcome to another FemaleFriYay, where you can't be what you can't see. Today, we're going to fly over to Canada, and now this lady, I believe, is some superstar paediatric pain stroke regional anaesthetist. This is Assistant Professor Deepa Kattail. How are you doing, Deepa?
I'm great. Thanks for having me.
So we're going to
Great.
start with a really easy question. Deepa, what's your name? Where do you come from originally? And where are you currently working?
Okay. So my name is Deepa Kattail. I am originally from Canada, from the Toronto area, was born and raised here. And I am back in my hometown now. I just started a new role in Toronto at Hospital for Sick Children. So yeah, that's where I'm working now. And I've had quite a journey to come back home. We'll hopefully talk about that later in the interview.
Okay, so
Yeah.
tell me, what got you into pediatric pain and regional anesthesia?
Well, I did my residency in Chicago at a hospital called Rush University Medical Center, which was the biggest orthopedic hospital in the Midwest. So straight up from my anesthesia training, I was really heavily into regional anesthesia. We had not only our main hospital operating room, but we had a surgery center, which was just packed with tons of regional anesthesia. Like one typical day, even as a resident, we're doing 6 to 8 blocks, outpatient, really quick stuff. And same thing in the inpatient, in the hospital side as well. So right from the get-go, I was really into regional anesthesia. And I think it's just a super exciting field. Even from when I started my residency in 2009 up until now, I feel like every month there's some new block coming out, something new to learn. So it really keeps me on my toes in terms of keeping up with what's happening in the anesthesia world.
And what do you think you might do if you weren't an anaesthetist?
Well, I did my initial intern year in surgery.
Oh, wow.
So I don't know if I would have stayed in surgery. I'm not really sure. When I interviewed after I had a preliminary surgical year that was just a 1 year contract. And then for my second year, I had applied for anesthesia, surgery, and actually OBGYN. I only had one anesthesia interview, so I got really lucky that I got that. So I don't know, maybe it was meant to be. That was supposed to be an anesthesia, but I think it would have been probably something peri-operative, surgical, because I really loved operating.
Okay, so what's your
Yeah.
favorite part of your job?
Well, I work solely in pediatrics because I'm at a children's hospital now. So, infants, kids, and teenagers. Um, I think oftentimes the favorite part of my day is just meeting, these cute little kids, taking care of them. There's just such an innocent population. A lot of kids, we get a lot of sicker children, obviously, who, no choice of their own are just born with unfortunate circumstances. And the great thing with pediatrics is that a lot of them get better. It's nice to see that because they're growing, prognosis is a lot better. And I think just the medical field is going, we have ex preemies or ex 24 weekers who are thriving and alive, but may have some medical problems and come to our ORs every once in a while. But yeah, I really, really enjoy working with children. And my previous role, I was doing a little bit of adult, but I was happy to give that up and just be fully dedicated to pediatrics.
Awesome. Now,
Yeah.
as a passionate regional anesthesiologist, what's your favourite block? And if you don't have one, you can tell us your
Yeah.
favourite dinosaur instead.
Okay. Um, I think the one block I still really love is just a good old popliteal, like at the sciatic level. It's
Yeah.
just sometimes it could be a challenge to visualize, it could be a challenge to position. But I think when you get a good visualization, you get that nice ring of local anesthetic, and then, just it's a really nice dense block. They'll cover a lot of leg surgeries, foot surgeries. And it's just satisfying too, because we know that, foot surgeries are so painful
Yeah.
without a block. So it's very satisfying to do that block. Yeah.
So what we're going to do now, we're going to have our 1 minute block break. I have got my
Okay.
timer, questions completely unrelated to anesthesia. Are you
Oh, okay.
ready?
I'm ready.
Okay, Deepa, what's your favorite type of music?
Oh, 80s music.
And what's the first thing you do in the morning?
Brush my teeth.
And what, if you could only eat one food again for the rest of your life, what would it be?
Poutine.
Oh, lovely. A
Yeah.
city break or a beach holiday?
Oh, beach holiday for sure.
And are you a couch potato or a gym bunny?
I'd probably say more of a couch potato after a long day at work.
Would you rather read the book or watch the movie of the book?
Oh, read the book for sure.
Do you have a guilty pleasure?
Binging on Netflix once in a while.
Okay, and what's your
Yeah,
desert island item?
probably a device of some sort to keep connected to internet and other people if I'm all alone.
Perfect. And finally, name something you're really bad at.
Soccer.
So going back to the more serious questions, so how have you got from the beginning to now being some superstar pediatric RA pain lady? Tell us a little bit about your career path.
Sure. So like I said, I was born and raised in Toronto, and I actually kind of made a very drastic decision when I was about 18 years old. I finished high school here, and I decided I wanted to go straight to medical school. And I looked at international options, and just based on parental pressure, the decision was made that I would go back to India, where obviously my family is from. So at the age of 18, 19, I dove straight into medical school as a 6-year MBBS program. It was pretty challenging. The curriculum in India, it was an English curriculum, but it was still pretty challenging. People were very studious there. After all that, I came back home to Toronto. I wanted to get into either the American or Canadian residency programs and through their matching system. So I took a year off. I did all my exams. I actually did a year of research at Toronto Western Hospital. It was in the surgical department because I wanted to become a surgeon at the time. And then I matched into surgery in Detroit. So I did a really, really busy surgical year, which I think was a good prep for anesthesia, doing just central lines, basic procedures, and just managing stuff on the ward. Then I matched into anesthesia, moved to Chicago, spent 3 years doing an anesthesia residency. Part of our residency, we actually rotated at the Children's Hospital, which at the time was called Children's Memorial, part of Northwestern, and that was a fully dedicated children's hospital. And that was my first exposure to pediatrics, and I just loved it. I think in the pediatric realm, it's a different atmosphere, and I just really loved it. And I got to work with, my first exposure was working with Dr. Suresh, who we all know is, one of the most well-known regional guys out there. So I already done some regional in my residency, and I went to do my rotation in pediatrics. And I got to work with him, meet with him. And because of his influence, that department was like very pro-regional. So I got to see a lot of regional in the pediatric population. And then I applied for fellowship in pediatrics. I matched at Johns Hopkins and moved to Baltimore. So I spent a really great year there. Also, Johns Hopkins is known for a very well-known pediatric pain department, including big giants in the field like Dr. Myron Yaster, Dr. Sabine Close-Byerly, Dr. Connie Manito, Dr. Benjamin Lee. So I was their fellow, and then I stayed on as staff, and I initially joined the acute pain service. And the acute pain service at Hopkins is not just acute pain, but a lot of cancer pain for inpatients, even chronic pain patients. And we would have 20 to 40 patients on our roster. So it was a really good experience. I call it an apprenticeship because I didn't do a formal fellowship, but just working with all these very senior people, it was almost like an apprenticeship for me. And then during my 3 to 4 years at Hopkins, I was involved in starting the pediatric regional anesthesia service at Johns Hopkins Children's Center. The culture was still a little bit resistant to regional at the time in kids, but we continued to do that, and we got more blocks going, especially with our orthopedic sports guy. And then I'm sure regional. You have to have a culture where people are open to it and surgeons are open to it, so that could be a bit of a challenge. And after a couple of years there, I wanted to come back to Canada, and I took a job as a pediatric chronic pain physician and anesthesiologist at McMaster University, which is in Hamilton, about 45 minutes from Toronto. Stayed there for about 5 years, got really involved in the chronic pain program, and also doing anesthesia at the same time. And then while I was on my maternity leave last year, I got a phone call from a close colleague who I know from the pediatric pain world here in Canada, and they offered me a position, and I've been here since July. And I'm going to be starting the acute pain service in January. And I'm already in the pediatric chronic pain clinic, and I'm also part of the pediatric regional anesthesia team. So we have because we're such a big group, we're about almost 40, probably growing to 45 pediatric anesthesiologists. There's different specialty groups. So I'm part of also the pediatric regional anesthesia group. So doing a lot more of the ortho and different things. Although I'll do blocks also for general surgery. And anywhere I can, I'll try to offer some kind of block.
Wow,
That's my
that sounds,
trajectory. So yeah,
yeah, that sounds amazing. It sounds like you've been really busy.
I've been really busy. Yeah.
Very busy. What do you think your biggest career achievement has been?
I think probably right now my biggest achievement is like the different works I'm doing different societies. Like right now I'm on the board of directors for Society of Pediatric Pain Medicine. I've been their chair of communications for a while now, more than 5 years. So just getting that society up and running where we're having our 10th anniversary coming up, but it's a small society of pediatric anesthesiologists, but we want to open it up to other disciplines. Locally in Ontario in Canada, I'm co-chair of the Ontario Chronic Pain Network, which is also, I'm the pediatric co-chair along with a colleague from the adult side. Other things, like I also was involved with setting up a website called solvingpain.ca, which I thought was brilliant. It's not geared towards anesthesiologists, it's anesthesiologists helping surgeons with the amount of opioids that should be prescribed for every surgery. So instead of giving 30 days worth of opioids, or on the other side, which we see a lot of, which is giving no opioids and just saying
Yeah.
take Tylenol and Advil, it's saying, okay, if you have an elbow fracture, it's okay if you give maybe like 3 or 4 doses, or if you have a lap appy, give some medication just in appropriate amounts. So that was a really nice website that I was part of. It was a big group of us who worked on it, and I did the pediatric section of that. Probably, I think the biggest achievement I'm just thinking of, I was the program chair for the Society of Pediatric Pain Medicine meeting. When was that, last year? Yeah, last year. And I thought that was a really great honor that I got to help organize the meeting. Yeah.
Wow, that's a long list. How did you get into
Yeah.
the Baby Blocks project? Because actually, it was John Hagan that said that I
Yeah.
had to absolutely talk to you.
Yeah. I think I just knew John professionally through the different societies, and he approached me, and I love to do any type of like educational type of work. And I was very happy he asked me, because I think we need it, because I have used the internet for my own, looking up stuff or using as a tool to teach my residents, especially in pediatrics. And we're just lacking a pediatric focused regional anesthesia resource. So I'm super excited to be part of it. And John is such a hard worker. It's such a visually beautiful website. I think that's one issue with us in medicine. Like we're not very savvy IT wise, but he's set up like a very nice website, very easy to use. And I think our goal is to be something that you can pull up on your phone 5 minutes before your resident or fellow does a block and quickly look at things. So it's been fun. I've contributed one block to that, which took a bit of time, and I'm hoping to expand to even stuff with like chronic pain and all that. But it's exciting because internet's kind of where it's the place to be, and our reach can be global and worldwide. So it's exciting to work on it.
Yeah, it's a very
Yeah,
useful resource.
very useful. Yeah.
What do you think's been your biggest career struggle?
I'd say it's kind of interesting because I feel like now that I was actually counting before the interview, I'm a PGY 15 right now. So I'm my 15th year post starting my residency. But I think, and because I've had 3 different academic positions now, I've started fresh at 2 new places. And I think as a female, physician of color as well, sometimes people don't realize what my background is, my expertise. Like even in both my last 2 roles, my first couple of days in the OR, I was mistaken for a resident, which is, I think I'm happy my skincare regimen's working well, but I think I have to I have to prove myself, like I've been doing this for a long time, where sometimes I wonder, I think probably our male colleagues don't go through that, when they see probably a male of my age, I don't think they would question like, oh, what's your experience? Are you a newbie? So sometimes that's a bit of a struggle. And I realize that with these struggles, our biggest allies are sometimes our male colleagues who defend us, and we're like, oh no, like she knows what she's doing, which is kind of sad that it has to happen that way. But, I think it's just the way it is. And sometimes it's our female colleagues are sometimes the most guilty of kind of, asking, not really believing our background or treating us the same as they would a male physician, maybe. Like I feel like a lot of times they might address me by my first name, but call the surgeon, male surgeon, doctor, so and so. Just little biases like that kind of creep up. So yeah,
It's very
it's just a struggle.
subtle.
It's very subtle, and it's sometimes a struggle because then you kind of feel like you're your achievements are kind of diminished. It's sometimes in front of the patient, for example. So, but I'm more aware of that, and I think it's not always the most comfortable to call out these biases, but I think it's important to do it, not just for us, but also for the next generation of female physicians coming up behind us.
And what do you think the best piece of advice you've ever been given is? It can be career or in your personal life.
Um, I think I had the lesson there's one lesson I learned when I was a very young child when I was going I think I was like 12 or 13 and I was going through like my hormonal phases and I wasn't taking an initiative to look for opportunities to move myself along. And I remember a teacher who knew me from when I was much younger from elementary school kind of saw me and was like, oh, heard that, oh, you're, what's going on? Like, I heard you're not, you're kind of like being a bit of a troublemaker. What's happening? And I kind of said, oh, the school is not challenging me enough. And she kind of said, like, you need to make your own opportunities. And even when it came to me becoming a physician and all the things I do today, I feel like I kind of search for the opportunities. I want to, even for example, when I became new staff, I wasn't very involved in any societies like Society for Pediatric Pain Medicine, Society for Pediatric Anesthesia. It can be overwhelming. You go to these meetings and there's all these speakers, so many people, and you wonder, how am I going to stick out in this crowd? There's so many people. But I think it's just perseverance, like volunteering for committees, getting known, getting recognized. It just takes small steps. And I sometimes I'm not good at this. Sometimes I should say no more often and focus on projects, but I have a tendency to try to say yes to everything and try to get it done. But it tends to work out, and then I just try to grab any opportunity I can and try to move things along.
Have you had any strong female mentors in your career?
Oh, definitely. I feel like at every phase and every job I've had, there's always been someone I really looked up to. At Hopkins, it was fantastic. We had so many really awesome female anesthesiologists I really looked up to. I mentioned a couple of them. Dr. Sabine Close-Byerly, she's retired now, but she was the founding president of Society for Pediatric Pain Medicine. She helped to move along and set up the acute pain service at Johns Hopkins when it wasn't really a strong service. And she just taught me a lot of lessons, even things like adding a medication to a formulary at a pediatric hospital. It's a very challenging thing to do. And I remember her telling me how much you had to push and use evidence. I think the one example she gave me was running ketamine infusions. So analgesic dose ketamine infusions on the ward. It's something that it took a lot. And once one hospital does it, it builds evidence for the next one. But I think Hopkins was one of the first ones to do it. So she was a good role model for me. Another big giant that I got to work with was Dr. Jeannie Heitmiller, who's a pediatric cardiac anesthesiologist. Super accomplished. She's a professor. She's chair of her department now at Children's National, Washington, D.C. And just seeing the biggest thing I learned from a lot of these female mentors is that they were able to achieve so much in academics and in our professional world, but also had kids at home, had families at home, and just they had, of course, there's always support from people at home, but they were able to really balance out having, and both of them have like very accomplished children right now. They're able to be moms and doctors and also do so much great academic work and leave their mark in the anesthesia world, especially in pediatrics.
Wow.
And currently I have to mention my other mentor right now is Dr. Fiona Campbell, who's a pediatric pain anesthesiologist at Hospital for Sick Kids. And she's just killing it. She was just the past president of the Canadian Pain Society. And just all of these people have also pushed me along, offered me opportunities. And I hope I can do that one day when I reach a more senior level and people come up behind me as well.
These women sound incredible. I don't see how
They're
they get
amazing.
the time to be like super mums, super
Yeah.
academics, and super doctors.
Yeah.
What advice, Deepa, would you give to women coming up behind you?
I would say, especially for those coming into academics, I think the best advice I got, which I think was from Dr. Yaster, and I don't know if you've ever met Dr. Yaster. He's pretty popular. I think once you meet him, you'll remember him. But one great piece of advice he gave was to find a niche, find a specialty area where not a lot of people are going into. And at the time when I graduated fellowship, the two niches that were very in demand were pediatric cardiac anesthesia and pediatric pain. And another thing I try to do, which I think has really helped me move my career along, any work that I do in terms of work in professional societies or projects I do, I try to keep that same theme. I try to always make sure it's somehow connected to pediatric pain, either acute pain, chronic pain, or regional anesthesia. So there's a story going on so that when you look at your career down the line, I can say, okay, I focused on this one thing. And so I try to do any projects or anything I do, I try to do related to pediatric pain. And if there's something that maybe isn't that relevant, I just kind of say, okay, maybe it's not like my role for me. Like one role I accepted just for 1 year was to be the fellowship director for pediatric anesthesia, my last job, which was a good opportunity, but I didn't have as much experience in the educational area. And there's people who do master's degrees in education in their when they become faculty. But so I realized with that one experience, that's like a very specialized role, being fellowship director. And then when I came and I realized, you know what, maybe I'm better off focusing more on like researching pediatric pain or setting up like a clinical service related to that. So that's be the best advice. Keep a focus and try to do everything along that theme so that it'll help move your career along.
That's very good advice. And finally,
Yeah.
Deepa, to round up, can you tell us something
Yeah.
about yourself that we may not know?
Back in the day before I went to medical school, I was actually a classical Indian dancer, and I had the opportunity to dance professionally. And it's kind of funny, when I decided at the age of 18, 19 to go to medical school, for a little while there, I really was trying to choose, should I go to India to continue becoming a professional classical Indian dancer, or do I go to medical school? So sometimes I wonder, what if I'd made the other choice, or what my life would have been like?
You could have ended up in like on Bollywood movies, and
Yeah.
that would have been incredible.
Yeah.
Deepa,
Yeah.
you have been absolutely delightful. Thank you for joining us on Female Friday. And
Thank you for
I
having me.
hope that you enjoy the rest of your day.
I will. Thank you so much.